Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So the J&J story has been the big one this week. I heard it was compared to the AstraZeneca situation, and I'm wondering if you could expand on that and what more time is going to help us do here.
Well, AstraZeneca also was reporting blood clots, not necessarily specifically the ones that are reported with the J&J, but also a blood clotting problem. And that slowed things down, and plus that vaccine had limited efficacy against some of the variants. There's a lot of problems with the AstraZeneca one. But here now again, we've got blood clots, mostly in women under 50. There may be one man, age 25, supposedly in the United States, that was not included in this original report. All that stuff is being investigated now to see really who is at risk for this. Is it everybody, or is it just this subgroup of people? Because it's not 1 in a million people. That's 7-point-some million people have taken the vaccine. You know, women are half of that. And then women under 50 are a fraction of that. So for a certain group, it may be something that is going to limit the use.
You probably addressed this yesterday, but I wasn't here. So if you have the Johnson & Johnson vaccine, should you be worried?
Well, okay. It's still maybe 1 in 200,000 to 500,000 people. So it's a very, very rare event. If you have any kind of neurologic problem, even a severe headache, somewhere, 6 to 13 days after you take that vaccine, go see your doctor immediately. Maybe even go directly to an emergency room. So there's a time frame, 6 to 13 days after the Johnson & Johnson vaccine. So I would say, we don't have to be hysterical about it with with this kind of low level of risk. But you just have to be aware that this could be a problem.
I know you answered this question early on, but someone asked me about this recently. If you get the shot and liquid runs down your arm, does that mean you didn't get the whole vaccine, or is that just nothing to worry about?
It's really nothing to worry about. The bulk of it got in there. Just a couple drops is really nothing. So you don't worry about that.
People are talking about how they've been fully vaccinated, and yet some people will still get infected, and we've talked about that.
Yeah.
Can you say, though, is there a population that's more at risk for that happening to?
Well, that's a good question, Larry. Certainly people who have an underlying immunodeficiency, the vaccines don't work as well. But what's being reported now, the CDC reported 5,800 cases of COVID in people who were fully vaccinated. And it's all age groups, although 40% of them are over 65 years of age. Still, that's only one case for 13,275 people who got vaccinated. So it's a very small percentage. Remember, these things don't work 100%. They're in the 90% range for the mRNA vaccines and the low 70s for the other ones. We're going to see this. Most of the cases here were mild, but 7% of the people did end up in the hospital, and 1.2% died. 74 people died.
All right, we're going to get to some viewer questions now. This person says, if all the clotting issues with the J&J vaccine occurred in women, why make men pay by withholding the vaccine from them?
Well, no, this is a great question, and this is what the committee who's advising the CDC is looking at right now, because they have to make the hard decision. Are we going to say women under 50 aren't going to take this vaccine, or people with this kind of condition, maybe a blood clotting condition or something like that? They want to do a deep dive into these specific patients, and they want to gather all the information from around the world. Johnson & Johnson is everywhere. So it's not just the United States. So that's what's going to take the 10 days. So they want to make when they come out with their decision, they want to have some data behind it and be ready to make that kind of statement. But this could actually be the case.
All right, here's the next question. When they tweak the mRNA vaccines to cover new variants, do they have to go through the same long trials for approval, or will it be like the flu shot, which they can retool every year?
Well, when they tweak the vaccine, you're talking about a really minuscule molecular level change in the vaccine. It has an incredible effect on the immune system, but it's a teeny effect on the vaccine itself. Now remember, the vaccine comes packaged in this lipid capsule thing. All that stuff is the same. And so, we know that how the vaccine is delivered is completely the same. So, they're going to have to do some kind of little bridging study, I'm sure, but they don't have to go through these big, long trials.
All right, last question. What are your thoughts about attending indoor bridal showers and weddings this spring and summer? I will be fully vaccinated, but can't assume everyone else will be.
Well, as you've been reporting, every day the numbers are up 156%. I think the indoor parties, bridal showers and weddings, I think for this spring and summer are really not going to be realistic. Now, as more people get vaccinated, possibly restrictions on people who are fully vaccinated will loosen up even more. This is just a possibility. Now, they've talked about vaccine passports and whatever. Perhaps small gatherings would be allowed in the near future of people who are just vaccinated. So, that could happen. It doesn't exist today, but, by the end of the summer, maybe this is going to happen. I mean, something's got to give with these vaccines, right? I mean, we're taking the vaccines to, so we can get back to some kind of normal life. That is likely to happen, but, you better prepare your guests. If you have a late summer wedding or something, tell them to get vaccinated now.
All right, if you have a question for Dr. Murphy, you can head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow at this time. Thanks, Doctor.
See you tomorrow.
Thanks, Doctor. 12 minutes after 7.